Patients with trouble remembering their medications, I think it really helps them take their medications on time. And for me as a future clinician, it's really important that the patients are taking their medications as prescribed, and really helps the patients get to that point where they can take it confidently and where I'm confident that they're taking it. I worked through the video interface, which I thought was really innovative, especially during COVID, because it lets me connect with the patient through an online interface. The video interface really lets you talk about more than just medications as well. It lets you talk about wellness. And during COVID, especially, there's a lot of isolation for patients, and it was really important to talk about things like mental health. And I think patients really appreciated that. It gave access to free cognitive behavioral therapy programs, and that's not something that everyone knows about. But because pharmacists are well equipped, they're able to provide mental health support as well. I was able to help refer patients who needed that support. The biggest clinical improvement for me was the patient's adherence to the medications. I was actually able to track that through this interface. You can see when patients were missing their medications, you can see whether there's trends. So are patients getting better, which was a really good sign. And that was really useful because that lets me, that alerts me as to whether the patient needs more support from me. It could automate asking survey questions. So it could ask patients certain things about medications, whether they're experiencing any side effects. That was really good too because it lets me do follow-up much more easily with patients. For me, I think the people who benefit are people who have multiple medications. If you have quite a bit of medications, I think it's going to be the right tool for you because it takes sort of the stress as well as the pressure off of you from taking your medications at the right time. I think that the technology is definitely available and user friendly enough for patients who might not be too familiar with the interface.